Okay, thanks again. Now we're really going to get rolling. Thanks everyone for your patience. A couple of housekeeping things up the top. So this is a Zoom meeting, so please make sure to keep yourself muted. You're not using any video feature, so feel free to turn that off if you have it on. We are recording this session, so you'll receive that full recording. You'll also receive these slides as well as the report that we will be referencing throughout this webinar. You may also use the chat feature for any Q&A. We'll be looking through those throughout the session, and if we're not addressing them during the session, we'll get to your questions at the end, so please think of that. And without further ado, I will turn things over to Ted Hart, President and CEO of Krafft America. Take it away, Ted.
Thank you. Thank you for joining us today. Today, Krafft America shares Volume 2 of the Voice of Charities Facing COVID-19 Worldwide report. The sheer magnitude of this global pandemic has made it necessary for us to update our first report issued just 1 month ago, with plans already underway to issue Volume 3 next month. The need is greater. The effect on nearly every community around the world is greater than just 30 days ago. What we have to share today is important for all donors and charities to hear as our virtual coalition around the world struggles to hold together a fragile global social safety net, one which is now being stretched as it has never been before. A stark reality is coming into focus. The need is so great, it is beginning to fray the foundation of support so many vulnerable populations have relied upon in the best of times, and makes all of us ask, are we doing enough? What more must be done? How will communities rebuild? To give some context on what is happening around the world, in the United Kingdom, reports are showing a potential loss of income to the charitable sector exceeding £4.3 billion. And recent research finds that the UK is facing potential closure of 40 to 70% of charities throughout the country. Survey shows that 40% of charities in the UK have 3 months or less of operations in reserve. Many have 0%. These reserves will and have been depleted. Research by our partner TÜSEV in Turkey shows 50% of charities in Turkey say they can only survive another 6 months. 80% said that they could only survive 12 months. There's a genuine concern about the resilience of charities around the world as this global pandemic continues. But where there is darkness, the light shines even brighter when it comes. During today's webinar, Krafft America makes special note that this is a holy time for over 1 billion members of our human family, a holy time for our Muslim brothers and sisters around the world. Ramadan is a particularly important time, Zakat placing a particular focus on duty and acts of charity. This second report on the Voice of Charities Facing COVID-19 Worldwide gives voice to charities in 122 countries. It draws all our attention to the very survival of charities in every country on the planet. There's a growing sense of desperation coming to many sectors in many parts of the charitable world. A lack of options for survival is real for many. Today, we want to bring light to the darkness and bring hope to many as we learn about the needs. We can begin to imagine new models, new approaches, new partnerships, and new tomorrows. Next slide. There we are. I am Ted Hart, President and CEO of Krafft America and President of Krafft Canada. I'll be joined a bit later, next slide, by Jessie Krafft, who is our Senior Vice President of External Affairs here at Krafft America. Let's get right into the report. Charities Facing COVID-19 Worldwide report. The data that we'll be sharing with you today was drawn from survey between April 30th and May 6th. Krafft America polled 880 organizations worldwide to learn how the coronavirus global pandemic continues to impact their work. About this survey. Next slide, please. 880 organizations were surveyed. 122 countries are represented in this survey. Throughout the slides today, you'll see a smaller number next to larger numbers. That smaller number is the corresponding number of our Volume 1 reports. So the way to read this particular slide is that 880 organizations participated in this survey. 30 days ago, we had 544 charities. In this report, we are bringing voice to 122 countries. 30 days ago, our report brought voice to 93 countries. Next slide. Here we want to give you a sense of the scope of this report. How many of those charities came from Europe, North America, Central America, Caribbean, South America, Africa, and so on. And for those eagle eyes that are looking through this and may wonder why does that not add up to the 880 that we shared with you, some of the organizations participating in this survey provide support in multiple countries and multiple regions, and therefore in this report we would show the results in each of the areas that they participate in. Next slide, please. You'll also see throughout this report a very broad cross-section of nonprofit organizations, the true tapestry of the charitable sector around the world. Not surprisingly, very heavily weighted towards children and youth and education, but across the board, you see services that are provided, and in many cases, provided to those most in need during this global pandemic. On the next slide, I want to welcome Jessie Krafft, our Senior Vice President for External Affairs here at Krafft America. Welcome here, Jessie.
Thank you, Ted.
Jessie, as you did 30 days ago for Volume 1, you're going to help us interpret these slides, interpret this data by bringing real-life examples from the survey itself, but also representing all of the advisors that report through you, the grants team here at Krafft America, for real-life examples of what are we seeing on the ground, what are we hearing from charities and the donors that want to support their work. On this slide in particular, Jessie, we see the immediate negative impact of the coronavirus and the global pandemic. Nearly all, 94.38% of the responding organizations reported that they are being negatively impacted by the coronavirus global pandemic. Over 70% of the respondents, Jessie, have seen a significant reduction in contributions that they have received and had to suspend programs involving travel or other events. So Jessie, help us bring this to life. Help us understand this again, bring voice to the charities that are experiencing this negative impact.
Yeah, thank you, Ted. And you'll see throughout this presentation and the data that we'll share with you after this presentation that the negative impacts have been widespread and have covered many aspects of the work that our charity partners do on a day-to-day. The quote here, states that our organization reached approximately 25,000 patients in remote rural areas annually, helping them get surgeries and medication, but they were forced to suspend this initiative due to the coronavirus pandemic restrictions. And this quote here is significant because we work with many healthcare organizations that have suffered because resources and hospital beds are diverted to COVID-19, or they are no longer able to access the communities that they serve, and they've had to halt important medical research, or they can no longer provide in-person care that they used to. And so this just highlights one area of the negative impact, but it's certainly been widespread, as you'll see in the data in the following slides.
Certainly in the data that we're going to be presenting today, Jessie, and in the report itself that all of our listeners today will be able to download and read the richness of this report that our Vice President Kinga Eli and her team, the thought leadership team here at Krafft America, have created in this Volume 2. But I just want to stay on this negative impact over the last 30 days. Can you give us a sense of what your team is reporting to you and what you are hearing yourself in terms of directly from the field, how real this change in 30 days has been?
Yeah, of course. And, well, first of all, we are actually seeing effects of COVID-19 itself within some of the ranks of our charities. We unfortunately heard that the executive director of one of our partners in Brazil passed away due to complications with COVID-19. So, I think most of the negative impacts that we'll talk about today are are related to the ripple effect of COVID-19 or the closure and the the inability to provide in-person services. But know that there are some organizations that are experiencing effects of this illness themselves. So that has been a challenge that we've faced in some work as well. And I think
Jessie.
Yes, sorry, go ahead.
Yeah, well, I just wanted to go on to the next slide because you mentioned this ripple effect, and I think the next slide, and I know you've got a lot to share here, but I want to give some context to that. You can see throughout this slide which areas our respondent organizations are being impacted due to the global pandemic. But in particular, I wanted to draw your attention, because I think this is where you were going, is that when you look at contributions have been reduced, just in the last 30 days, that number has gone from 68% to 73%. And then look at the other side of that dial, and you see that at the same time that less contributions are coming into charities, their expenses are going up. And so now from 34% to now 39% are reporting to us that their costs are going up at the same time that their contributions are going down. And Jessie, that's a ripple effect that's got very danger written all over it.
Yeah, absolutely. And I think to illustrate this, there was a great quote from the Wall Street Journal on Monday, where Betsy Morris noted in her article that, quote, "Nonprofits are reeling from the loss of revenue and soaring demand. As the virus has sapped revenue for nonprofits, it has also been a double whammy in driving up their costs for masks, cleaning supplies, technology, and food." And I think this quote is very relevant in this context, because that's certainly been the experience that we've heard and seen within our organizations, that their costs are increasing exponentially, and that they've had negative ripple effects because of those increasing costs, which have then cut into the services that they are used to providing to their beneficiaries. And so this has had huge impacts. One organization that we work with works with youth in foster homes, and they've experienced, just as an example, an increased demand for services and an increased demand for more food supplies, and then extensive costs for digitizing in order to stay connected with all of those youth that they support, while at the same time their funding has decreased significantly. So this is just one of many examples where the need is greater, but they don't have the ability to fully support. So many are dipping into their reserves if they are fortunate enough to have reserves. And then for many of them as well, their main annual fundraisers have been canceled, fundraisers that occur over the spring or the summer. And so there's not a great end in sight in terms of their ability to recoup those costs and to supply the additional support that's needed.
And many let's move on to the next.
Sure.
I just want to move on to the next slide, as you were mentioning sort of that journey going forward. On the next slide, what we see in this research is just what you might view as sort of a very dire prediction of the future, is that when you look at the expected negative impacts, so you've just shared with us sort of those current negative impacts of funding going down and costs going up. But what is the thought on the part of those who are actually on the ground managing these organizations? What does the future look like? And it looks to me from this data, and I want to have you help us interpret this data, is that things are maybe the crystal ball is a little bit clearer for charities in the 1 to 2 month time frame, and that that a lot of these charities that had reported to us last month feel that they can get through the next 2 months. But boy, Jessie, you look out at 3 months, and for the first time, we're over 50% of the charities, actually 55% of the charities, that are saying that the negative impact is going to be here in 3 months' time. So it's that same sort of cliff effect that I think a lot of charities are really expecting, that things are going to be far worse in 3 months than they thought even a month ago.
Yes, Ted, it's a really tough situation, and I think it's positive that they're seeing some good news in the short term, but in the long term, I think there's so much uncertainty for all of us. And even in cases where some of our organizations are reporting that they're continuing to receive funds from some of their donors, I think there's a lot of uncertainty about whether that funding will dry up in the long run. You know, as I said, many spring and summer fundraisers have been completely canceled. And then, you know, there are also many in the fall that they're looking towards now in order to supply the fundraising that they need. But they're not even sure that those will be able to continue either.
Yeah, and Jessie, here on this slide, I think just to bring that into stark reality, is, you know, one of the charities that participated reminded us that, you know, as bad as this global pandemic is, you know, their biggest fear is not only will they not survive the global pandemic, but the next disaster that might strike. And as time goes on and we get into that June to November timeframe, which is hurricane season on the East Coast of the United States, you know, that hurricane season, which is just over the horizon now, there are resources that are already depleted, already stretched, may just be the breaking point.
Yeah, I think there's a lot of uncertainty about what could happen in disasters and other crises that, you know, that come up in the provision of services in the social sector, in the civil society sector. And so we are hearing, you know, charities that are usually planning ahead for this type of activity around this time. They're quite concerned because they're utilizing their reserves or all of the resources that they would have spent later in the year. They're spending those funds right now. And so I think there is definitely concern for the possibility for disasters in our near future.
Yeah, and Jessie, going on to the next slide, for 13.42% of charities, that disaster is already hit. That's up from nearly 10% just 30 days ago of charities who have already been forced to suspend their work and their operations. As a matter of fact, one of our team members today just brought to my attention a charity that's communicating with us right now that had to make the decision to close on April 30th. So almost 15% of the organizations surveyed were forced to suspend their operations as their activities cannot be carried out remotely. So that's another percentage of that they're not just closing their operations, but they weren't able to carry them forward. But 60% have reported that they had to eliminate or suspend some of their regular programming due to the global pandemic. So, Jessie, these numbers are not positive and they're not getting better.
Yeah, they're absolutely not. And, you know, I think in terms of the operations of organizations and what we were anticipating starting this, you know, we were initially expecting a lot of delays in communications with our grantee partners. You know, we weren't certain. We had many donors that were starting to think about their relief plans and their relief strategies. And, you know, in the beginning, we were telling them, well, we're not sure how responsive they're going to be to their applications that we're asking them to submit and things like that. But, you know, we've actually been surprised by the level of continued connectivity, as at least by some of their key staff. And while some of their programs, in many cases, have had to be suspended, there are many that are still trying to be connected and responsive to try to, you know, raise the funds that they need in order to proceed with their activities. But yeah, I fear, Ted, that we're going to start hearing from a lot of our charity partners that they have, you know, decided a future date upon which they'll actually close their operations. So yeah, it's something that we're going to be keeping our ear to the ground in terms of notifying donors and making sure we know which organizations are still in operation.
Yeah, absolutely, and that's going to be something that, of course, Krafft America will continue to monitor. Jessie, and it's not the sort of thing that, you know, these are easily renewed in terms of, you know, when an organization closes down and the staff is dispersed, the operations are no longer you know, underway. That's oftentimes not something that can just be turned back on.
Yeah, and a lot of the message in the narrative comments we received through the survey, there were so many messages around, you know, what are the most important things that they needed to focus on. And so many of these organizations said, you know, we've got to focus on our staff because without our staff, we're nothing. And of course, many of them have had to make some difficult decisions around their staffing. But But you're right, if these organizations are forced to disband, they lose one of the greatest assets they had in the first place, which was their staffing. So, I know a lot of donors right now are focused on immediate relief and providing funding now because it's needed now. But I think, similar to many disasters, right, we tried to provide the guidance that long-term funding and long-term resiliency and sustainability funding is also incredibly important and is often overlooked in the rush to get funding to charities as quickly as possible in the wake of a disaster. So just as for the donors listening, try to keep some of your funding aside for the long-term resiliency and that necessity, because it will be more and more necessary as we proceed in the next few months.
The quote here, of course, Jessie, is of an organization that is already anticipating that they're going to have to dissolve within 6 months. And of course, for those who rely on their services, that will hurt many communities. Let's go on to the next slide. On this slide, we had asked the question of whether or not the organizations are able to operate remotely. The emphasis for a lot of sort of government notices is to telework, but not everybody, Jessie, can telework. Not all work is able to be done remotely, and that's really affecting a lot of charities.
Yes, it definitely is. I'd say, one of the challenges that Krafft America, and I'm sure many other organizations, are facing right now is that we are experiencing a huge increase in the requests to modify past grant agreements because, for many reasons, because the project we had agreed upon can no longer take place, or, just a number of other reasons that project, can't move forward as we had originally planned. And we've, of course, we've been working with donors and have been very accommodating to these requests to make modifications. And many of the shifts in funding have actually focused on funding digitizing projects and shifting them to remote access to allow them to continue to the extent that they're able, at least. So our even past grant funding has been shifted to the purchase of laptops and small equipment for remote operations. We recently made a grant to a charity that fully supported their remote operations. Prior to our grant, they had no remote capability, and they came to us fearing that they would need to close their operations totally simply because they did not have computers that they could use at home or things like that. So in this instance, we were able to provide them with the funding that they needed to continue their operations to the extent that they were able to. And I'd say it's really has been inspiring and amazing to see the creativity of our grantee partners that have continued to provide programs remotely. One story that I've read in the survey data was that one of our partners that assists students with reading, with increasing their capacity for reading skills, is working on developing a video game that would continue teaching reading skills remotely. And I think, these are activities that none of them would have imagined they would have had to complete this year, or that they would have needed programmers to work on these projects to keep their operations running. But we've just seen a lot of creativity. But of course, as this data shows, there are many organizations that simply do not have the ability to continue operating remotely, and so have completely canceled their programs, or that there are things like orphanages and animal care facilities or zoos or things like that are still requiring operations on site because they don't have any other choice. So their staff are forced to stay on site and take protective measures for themselves and for the beneficiaries that are with them on site.
Jessie, you've got a couple of quotes here. We're going to go to the next slide and have you sort of share a couple of these stories.
Yeah. So these quotes, which I'll read, they're, overall they speak to, there are a wide variety of concerns about potential humanitarian crises due to the virus itself or the social and economic ripple effects that the closure has had on the world. So the first quote is that the economic impact of the pandemic on migrant workers is predicted to become increasingly severe. Those who show symptoms of COVID-19 are laid off, but due to travel restrictions are unable to go home to their own countries where they would have had access to a support system. This organization's concern was that about 7% of the children born to the 4 million migrant workers in their country are at high risk to become victims to human trafficking, child labor, or are facing neglect due to economic problems faced by their parents. So I think, as we've even heard within the United States, there are huge concerns for migrant workers and those that are not legally in the countries in which that they find themselves in, where they don't have any sort of support system.
Yeah, and Jessie, just to give a number, 7%. It's like, what is that number? That's 280,000 children who, because of this. Because of the lack of support during this global pandemic, are more vulnerable to child labor and human trafficking, as you noted, and that just breaks your heart.
Yeah, it's a very dire negative impact of the situation. Absolutely. The next situation, which has also been in the news quite a bit, is the great concern for families that are living within overcrowded camps in Syria is what is in this quote. But there are many different refugee camps around the world that are very concerned about the close proximity of the people within those camps and the lack of access to healthcare in those situations. So this organization that we work with is now running a project focused on delivering basic household materials such as blankets, water storage containers, and cooking sets to these families. And without that support, the families would not have those essential items, which would then heighten the risk of virus transmission. So they're trying to provide support to keep people in place as much as possible and to decrease the social contact.
Mm-hmm. Jessie, we're going to move on to other actions that the organizations in this report have taken due to the coronavirus pandemic. And I think when you look at this, sort of your eyes naturally go to the right. And I think that, most donors, most funders would expect that there would be some belt tightening and at least some attempt to raise new funds. But where we tend to look is at the other end, and which looks like, well, those aren't big numbers, but those are very big numbers when you think, Jessie, about 17% of charities furloughing employees, another 12% have laid off employees. 15% are not able to pay the bills of the organization, and another 17% have reduced salaries. And even though you can say, well, okay, that's the right thing to do and try to protect the organization, but you start reducing salaries of furloughing employees and not paying your bills, and that's not painting a bright picture, and it's not inspiring people to give their all.
Yeah, absolutely. Yeah, so the numbers on the left, while they seem like they're smaller, it's still a very significant number, and one that, based on the future predictions that each of these organizations has had, that we anticipate increases in those figures on the left around reduced salaries and layoffs and things like that. Many organizations have said that they're trying very hard not to lay off and not to reduce salaries to the extent that they're able, but it's definitely in their future unless they receive additional funding. So some organizations are dipping into their reserves and things like that, because their staffing is, of course, so important to the fulfillment of their missions. We've been hearing a lot about.
I was just going to remind everybody of something that you said, early on today, that, most charities historically are on a razor thin margin. Research coming out of the UK is showing that 40% of charities there have less than 3 months or less of reserves. So, we start talking about, well, you're going to have to spend your reserves, and that's what the reserves are for. But most charities don't have reserves. Most charities literally are on a razor's thin edge. However, vulnerable communities rely on them, Jessie.
Yes, yeah, absolutely. And we've been hearing a lot about charities that are employing new methods of fundraising to replace lost income. And this is, we of course don't know how successful these methods have been or will be if they're planning future fundraising, future creative fundraising methods. So it's something that we'll definitely be watching with our charity partners over the coming months to see how successful they've been with these alternative methods that they're trying to employ in order to raise or replace some of that lost income.
Let's go on to the next slide, which really, again, brings home this message that is coming clear in this volume 2 than even in volume 1, and that is the expectation. Now that we're 30 days past the first report, charities have already been working at trying to tighten their belts and raise new money and be creative and tackle what you mentioned as the double whammy, fewer donations but higher costs to get the same job done. Jessie, you look at this, and for the very first time, we're seeing that 50% of the charities participating in this survey believe that their revenues are going to decrease more than 20%. When you're on a razor-thin margin, Jessie, how do you make it with 20% less? You can't provide the same service. You can't be the same organization.
No, and the difficult part for many of these organizations is that they're being asked to provide more with much less. So this is obviously, it's a very real concern, and it's truly changing the landscape and fabric of philanthropy and civil society. Historically, civil society organizations exist to fill gaps in government and social services that are provided publicly. But their roles are becoming reversed in this situation. In some countries, certainly not in all, the government is stepping in to support their nonprofit sector because they understand the value that they bring and the fact that they are providing services that the government isn't necessarily fulfilling on their own. But there are many countries, most countries, where the charitable sector is not receiving any government support. So we did read there are some cases where charities are receiving new and more government grants, but in many cases that's just not the reality. So they're having to try to find that funding elsewhere or risk closure of their organization.
Jessie, again, our message here today for funders and for charities is, this is a new reality. This is a global pandemic. What you're experiencing is real. The decisions that you're making right now are real. And I think for the philanthropists that are listening, the advisors to philanthropists that are listening, in our mind, this is not just the next disaster. This is literally rewriting the book of philanthropy, and the decisions that are being made now are the stories that will be told about in the future. Let's go to the next slide, Jessie, because 17% of those who are participating in this survey, 17% did not receive any funding in the last month. So we're not talking about, 3 months from now it's going to be tough, or I'm going to experience a 10 or 15% reduction. In the last month, 17% of charities received no donations. And among those, Jessie, that received financial support during the last month, the great majority were awarded smaller grants. Several respondents have reported challenges to connect with their long-term donors, while other organizations receive grant funding with delays. So, I put this into context. Yesterday, we had a really terrific webinar with 3 of our leading corporate supporters, and every one of them literally rewriting the book of philanthropy, as I mentioned, where they are giving more and they are reaching deeper and they are trying to give a broader funding and to be more flexible in giving that. What's very clear from the charities' point of view, from the data that we're sharing today, Jessie, is that those great stories that are told and those examples that are real and able to be shared are unfortunately not the norm for most funders, certainly not the reality for many of the charities.
Yeah, absolutely.
Going on to the next slide, did your organization receive funding? So unfortunately, 17% received nothing. But taking a look at those who did receive funding in the last month, what did that funding look like? Well, 44% received funding from corporate donors, 48% from foundation donors, and historically it is true, individuals are the largest funders of philanthropy. Certainly that's true here in the United States and is the case in many Western countries, 65% from individuals with 28% coming from institutions. And of those who gave were the donors long-term donors? Well, 38% of those were long-term donors. You know, you mentioned in the slides about 3 slides back that charities are trying new approaches. They're trying to get new donors. They're trying to at least be optimistic that there is another path to success. Yet right now, 30 days past our first report, only 8.4% are new donors. And then of those that did receive funding, 54% was a combination of long-term donors and new donors. But Jessie, this is a very difficult picture.
Yeah, and so we have seen a great outpouring of support from the corporate sector, but there's been much concern expressed about the sustainability and reliability of corporate donations moving forward. You know, as you mentioned, we had a great webinar yesterday, which included speakers from Cargill, the Citi Foundation, and Biogen, and then we had 3 other corporations represented on a prior webinar that we held last month. But through these webinars and through, you know, the experience that we have on a day-to-day with our donors, we are currently seeing considerable efforts on the part of corporations to continue their normal grant making. They're really trying to, you know, keep their typical programs on schedule, and, you know, to remain a reliable source of funding for some of their ongoing partners. But you know, and then also on top of that, to remain flexible with past grants that they've already have made. So, you know, where they're enabling some of their charities to change the grant agreements that they've already had in place with them. But there's a lot of concern about the sustainability of those contributions moving forward. So we're right now seeing an increase in corporate grant making, but you know, as new budgets are created for the next fiscal years, given the new reality we're living in, we just don't know what corporate philanthropy budgets will look like. So many of the charities have expressed concern around that. And they've also expressed that they understand that their individual donors in many ways are suffering themselves. You know, they're facing job losses and things like that themselves, so they don't know how much they can continue to rely on this 64% that they're receiving from individual donors.
And of course, in the back of the mind of most institutional donors, Jessie, corporations that we work with, foundations that we work with, there will be another disaster. There will be another great need. And where does the funding come to support those needs? And I think that's why the position that this is a whole new philanthropic story. This is not just the next disaster. This is a very big deal. Let's move on to the next slide. What type of funding is needed by charities? This is really bringing voice to these charities from around the world, speaking directly to funders, Jessie. They're saying that they need unrestricted funding. They need regular project funding. These are the needs that they have. And while COVID-19 funds are desperately needed, and in many cases, these are new needs that these organizations have, that represents about 14% of what charities are looking for. Unrestricted funding, of course, being the most difficult to come to and to be able to ascertain from most funders. Jessie, talk us through, how do you see funders and what they want to accomplish and what they need to accomplish? After all, it's their money, and they need to have an assurance that it's spent wisely. They want to be impactful. They want to make sure that they are making a difference with that money. At the same time, that charities are stretched beyond any measure that they've been stretched at and are being asked to do more.
Yeah. So, As I mentioned, we've seen a lot of flexibility from donors in terms of the management of past grants. So, for example, many donors and charities have in the past worked out very specific projects and project outcomes that they had wanted to accomplish with their philanthropic dollars from the past year. But as many charities are now coming to us asking to change these past projects to better suit their new needs, the donors have actually been very flexible to that and very understanding, which has been wonderful to see, and has given these grantees a lot of confidence in being able to continue their work with some of that past funding. But I think it's been interesting also to see that with the new funding, donors are still requiring project proposals, and while some of those proposals and what they're accepting in those proposals might include significant operational costs, so includes specific funding for certain staff members or things like that, they're not specifically funding unrestricted grants right now. So they're not kind of writing a blank check at this point. And I think that's something that charities really want. So we're working kind of in between to help negotiate, where the need is versus what the donors want to fund in this context.
Mm-hmm. Jessie, in the next slide, we see that, and I think the story here is that we see even more of the charities who are participating in our survey are providing coronavirus relief. They are providing services, whether they be frontline relief services or essential services such as food banks and shelter and others. And this is most likely a story of it took that 30 days for some of these charities, about 11% of these charities, to be able to get online, to be able to provide those services, to assess and meet the needs in their communities. So more and more of the resources of charities, in this case, for the first time, over 50%, 54%, are now being drawn to the pandemic itself, which says that, as the pandemic goes on, the other resources and the other services that are not coronavirus related are going to become more and more difficult to provide.
Yeah, definitely. And I think you're right. I think it's taken them some time to get up and running in some of these cases. So they weren't providing these services before, but now they are. And I think in some of these instances, 30 days ago, they might not have considered their services to be essential. The social situation, social and economic situation has changed so much that, they've realized that the services that they are providing are now essential.
Well, things like, Jessie, like victims of domestic abuse, exactly. Veteran services, things of that sort that maybe 30 days ago were not seen as directly related are now front and center.
Exactly. Yep. So, I think initially people thought that a direct COVID-19 response meant provision of medical supplies or PPE and research, but need has really expanded well beyond those things as more people lose jobs and as essential services are taken away.
Jessie, watching the time, we want to go to the next slide and just share with all of our listeners today, the participants in the webinar today, of which we're very proud to have participants today from Canada, the UK, Australia, India, Russia, Hong Kong, Costa Rica, Japan, Jordan, and South Africa, and others. If we missed you, we're very sorry, but we're appreciative of you joining us here today. Coming up, Jessie, on May 21st, we have a podcast that will be recorded 3 p.m. Eastern, more from the front lines of philanthropy. These are advisors here at Krafft America that you and I will be speaking with, specifically asking the questions that are being asked of them and providing the answers. So this is sort of a group advisory session of what are those hot questions and what really can be the best answers to those questions. And I think particularly helpful to donors and the charities that they want to support. Krafft America has extended eligibility for many charities by 90 days, trying to provide relief to the paperwork of regulatory compliance for funding coming from the United States. Our website that you can go to, kraftamerica.org/COVID-19 response is updated on a regular basis. And right now we have over 236 eligible organizations representing organizations providing on the ground direct relief for COVID-19 in 48 different countries. We had the webinars are posted from last month, and we mentioned those here. And we also had a podcast that's also available at craftmerica.org/CAF podcast. And that's a continuation of our From the Front Lines series for podcasts. Again, watching time, we do have a couple of questions. Jessie, if you can hang on just for a second. There's an overall message that unrestricted funding is needed. Is there a way that donors, corporates, and others can support unrestricted grants without requiring a charity to go through the difficult and oftentimes expensive process of equivalency determination when they don't even have the staff capacity to do the work of equivalency determination paperwork? So what options are there for donors who want to give and charities who want to receive unrestricted funding if for whatever reason, doesn't mean they're a bad charity, they just can't qualify or have the time to complete equivalency determination?
Yeah, it's a great question because equivalency determination is, of course, very time intensive up front and is, from the United States at least, the only way that you can fund an absolutely unrestricted grant. So it is possible for it to be absolutely unrestricted, but you have to go through this more difficult process up front that many charities just can't accomplish right now with their capacity. It is possible. There are ways to fund unrestricted grants via expenditure responsibility. And essentially what that requires is just a conversation with the organization to say, you know, we have this grant funding for you. We have $20 and it's unrestricted. What is your current need and how would you like to spend that money? And then what we do is write that purpose into a grant agreement with them. So it is, you know, we ensure that it's charitable and then we do end up restricting it to that purpose, but we're allowing them to fully decide. And then of course, we tell them that if something changes and they need to amend that grant purpose moving forward, we can work with them to amend that grant agreement if needed so that they can, so that we can approve that project before they proceed.
And always important in situations of that sort is talk to us early. Never let us know on the back end. The earlier you talk to us, the more we can do to help both the donor and the charity come together around those topics. Let's go to the next slide. This is our last slide. We want to encourage you to be in touch with us because we are running a little bit long on time here. We are going to wrap up this webinar today and encourage any of you who still have questions to please email Jessie and I at info@craftmerica.org, and we promise we will respond and get an answer back to you. Thank you for joining us today.